So what can you tell me about hypertrophic cardiomyopathy in general?
Hypertrophic cardiomyopathy is a disease characterized by a thickening of the septum. This makes it or causes basically a cardiac failure, a congestive heart failure. The symptoms in the early stages is probably going to be fatigue, hypertension. There can be some swelling, shortness of breath. Those would be the main ones, or the main reasons why a patient will go to the doctor or to the hospital. You will do an electrocardiogram. You will do a chest X-ray, an echocardiogram. That will be the most important one to diagnose because this will evaluate the function of the heart and the ejection fraction. That is very important in determining the degree of the disease and the type of treatment that you have to provide to this patient. First, you will try to decrease the preload on these patients. You will treat them with diuretics. Depending if you may treat them with beta blockers. If the ejection fraction is less than 40%, you will want to treat them with an ACE inhibitor. Depending, if the patient has problems with arrhythmia, you may have to give calcium channel blockers to try and control the heart rate and control the arrhythmia. Basically, what you try to do is decrease the work of the heart. Mitral valve, either regurgitation or failure, or there can be stenosis also. And if that is the reason, you will want to replace or fix the mitral valve. And of course, this will be open heart surgery to replace the mitral valve, to replace the valve. And the other treatment can be just medical treatment, can be by implanting an AICD or automated defibrillator. And you will want to do this because these patients are at high risk for developing fatal arrhythmias or sudden death. So you want to have something in place that will protect the patient. First of all, this disease is, the treatment is only palliative. They will never be cured completely. They will always require some type of treatment. But heart transplantation will be probably the best. But without that, you will focus on decreasing the symptoms and improving the patient's life. And of course, the patient will have to do some lifestyle changes, like controlling the weight, low sodium diet, low fat diet, exercise. This will have to be moderate, nothing that causes more exertion on the heart, and stop smoking.